Okay, imagine your body's like a waste removal system, right?
Okay.
And then it just decides to go on strike.
Oh, wow.
Like all of a sudden, toxins are building up, your internal balance is all messed up, and, your blood needs a serious detox.
Oh, yeah.
That's essentially the reality of kidney failure.
Wow.
But the good thing is there's this thing called dialysis,
Okay.
which steps in like this ultimate backup crew.
Oh, nice.
So, big shout out to the London HeartbeatsZ Academy in the UK for giving us all this fascinating material.
Yeah, they're great.
We'll be diving into today, and remember to subscribe to The Deep Dive on Facebook, Instagram,
On all of them.
Spotify, and YouTube.
Yep.
For more deep dives like this one.
Yeah.
So today we're going to be taking you on a journey into the world of dialysis.
Cool.
We're going to be uncovering how it works, why it's a lifeline for so many people,
Mm-hmm.
and explore the different forms this life-saving treatment takes.
All right. Well, I think what's really remarkable is how dialysis has evolved to mimic our own kidneys,
It's true.
It's an incredible feat of medical engineering.
Yeah.
And it provides this critical lifeline when our own body's filtration systems fails.
It really is incredible. So let's break it down, like what exactly is dialysis?
So at its core, dialysis is a process of cleaning and filtering the blood, stepping in to do the job of our kidneys.
Okay.
So our kidneys are responsible for, removing waste products like nitrogen, maintaining fluid balance, regulating electrolytes and acid-base levels.
Yeah.
But when they can't do their job,
Right.
dialysis takes over using a semi-permeable membrane,
Okay.
which acts like a highly selective filter.
Right.
So this membrane allows waste products, excess water, and even poisons to pass through while keeping the essential blood components in.
So it's like an external artificial kidney.
Yeah, that's a great way to put it.
That makes sense.
And it's also worth noting that dialysis isn't limited to just kidney failure.
Okay.
It's also used in cases of poisoning or even drug overdoses.
Oh, no.
So it can clear these harmful substances from the blood
Okay.
and be life-saving.
Wow, that makes a lot of sense.
Yeah.
So now let's sort of shift gears and talk about when dialysis becomes necessary.
Okay. Yeah.
Like, what are the key situations where we think about bringing in this intervention?
So there's a few scenarios where dialysis becomes essential. One of the most common is acute renal failure,
Okay.
which is a sudden loss of kidney function.
What causes that?
It can be caused by various factors like injury, infections,
Yeah.
or even certain medications.
So those cases, it's really a race against time to get those toxins out.
Exactly.
Yeah.
And then you have chronic renal failure,
Okay.
which is a gradual decline in kidney function,
Right.
often linked to long-term conditions like diabetes and high blood pressure.
Oh, okay.
So in both of these
Good one.
cases, when those kidneys can no longer keep up
Yeah.
with their crucial filtering and balancing act,
Right.
dialysis becomes essential.
It's like this tipping point, right?
Yep.
Where your body just cannot compensate.
Precisely.
Yeah.
Now, beyond acute and chronic kidney failure,
Uh-huh.
there are other situations where dialysis plays a crucial role.
Okay.
When we talked about poisonings.
Right.
And then there's severe metabolic acidosis.
Acidosis, it sounds pretty scary.
Yeah.
What exactly is happening in the body then, and how does dialysis help?
So metabolic acidosis is when the body's acid-base balance is thrown off.
Okay.
It can be caused by a number of things, like uncontrolled diabetes
Right.
or severe dehydration.
Mm-hmm.
And dialysis helps by filtering out that excess acid
Okay.
from the blood, essentially resetting that balance.
So it's like a multi-purpose tool that addresses all these life-threatening conditions.
It really is. And then another time when it's needed is hyperkalemia, which is a dangerously high potassium level in the blood.
Okay, and why is high potassium so dangerous?
So potassium is crucial for muscle function, especially for the heart.
Right.
So when the potassium levels get too high, it disrupts the heart's electrical signals, leading to irregular heartbeat
Oh, wow.
and even cardiac arrest.
Oh, okay, so it can be really serious.
Yes, very serious.
Okay.
So dialysis can quickly lower those potassium levels, preventing those fatal complications.
So it's fascinating how it can target and correct like these very specific imbalances.
Absolutely.
Wow.
And then we can't forget about fluid overload,
Right.
particularly when it affects the lungs, called acute pulmonary edema.
Oh, okay. So in those cases, it's not just about filtering out the waste, but it's about managing the fluid volume in the body.
Exactly, exactly.
Yeah.
So if the kidneys aren't working, they can't remove that excess fluid.
Right.
That buildup then strains the heart, makes breathing difficult.
Wow.
So dialysis will come in and remove that excess fluid and give that cardiovascular system a break.
I remember that handy mnemonic.
Oh, yeah.
From the London HeartbeatsZ Academy material, the AEIOU.
Yes.
It really encapsulates, the common indications for dialysis.
It's a good one.
The acid-base problems, electrolyte problems, intoxications, overload of fluids, and uremic symptoms.
Right. Hits all the main points.
Exactly. So speaking of uremic symptoms, let's sort of dive into those specific signs.
Okay.
That might signal that someone needs dialysis.
Yeah, let's do it.
Yeah. So let's focus on acute renal failure first.
Right.
What are the red flags? Like if what are those telltale signs that someone might need dialysis?
So in acute renal failure, one of the most obvious signs is severe fluid overload.
Okay.
And this can manifest as swelling in the legs, ankles, or even the face.
So you can visibly see that the body's struggling.
Exactly. You can really see it. And then another major warning sign is refractory hypertension.
Okay.
Which is high blood pressure that just doesn't respond to medication.
So even with the meds, it's still high.
Exactly. It puts a lot of strain on the heart and blood vessels.
Right.
And then, of course, there's the uncontrolled hyperkalemia, which we discussed earlier.
Yeah. So are there any specific symptoms that we see with the high potassium?
So you might see muscle weakness, fatigue.
Okay.
Even irregular heartbeats.
Right.
Don't forget about gastrointestinal issues as well.
Okay.
So nausea, vomiting, poor appetite, even gastritis with bleeding can signal something's wrong with those kidneys.
It's amazing how, all these systems are interconnected.
Oh, they absolutely are. The kidneys are like the conductors of an orchestra, making sure everything's running smoothly.
Right.
And when they fail, the whole system just goes out of tune.
Wow. Yeah. So we need to pay attention to those signals.
For sure.
What about neurological symptoms? Are there any red flags there?
Yeah, definitely. So lethargy, general malaise, excessive sleepiness, even slipping into a stupor or coma can be signs of neurological involvement.
Right.
You might also see delirium, asterixis, regular tremors, and even seizures.
So it sounds like it's a cascade of increasingly serious symptoms.
It can be. It can be.
Yeah.
Another crucial indicator is pericarditis, which is the inflammation of the sac surrounding the heart.
Right.
This can lead to bleeding or even cardiac tamponade.
Wow, cardiac tamponade, that sounds scary.
Yeah, that's a life-threatening condition where fluid builds up around the heart and prevents it from pumping effectively.
Wow, so essentially if the kidneys aren't functioning, it can just set off this chain reaction of really serious, fatal complications.
It absolutely can.
So early intervention is key here.
Yes, absolutely.
Okay.
Time is of the essence.
And you mentioned bleeding problems before.
Yeah.
Are those common?
Yes, they can definitely occur. So you see things like nosebleeds, gastrointestinal bleeding. Other types of bleeding can signal problems with blood clotting, which is often linked to uremia.
Okay.
The buildup of waste products in the blood.
It's like a domino effect.
It really is.
Yeah.
So we talked about, fluid overload, refractory hypertension, uncontrollable hyperkalemia, gastrointestinal issues, neurological symptoms, pericarditis, bleeding problems.
Is there anything else?
2 more.
Okay.
Severe metabolic acidosis, which we discussed earlier, and a high BUN level.
What's that?
So the BUN level, or blood urea nitrogen.
Okay.
That basically means the kidneys aren't filtering the waste products effectively.
Okay, so it's like a combination of, the clinical signs, the symptoms, the lab results that give you the full picture.
Yes, the full picture.
Yeah, so we talked about, acute renal failure requires that urgent attention, but chronic renal failure can also lead to needing dialysis. But the symptoms develop more gradually.
Right.
So let's talk about those symptoms. What are we watching for in someone with chronic renal failure?
So pericarditis, which can occur in both,
Right.
can cause chest pain and discomfort, fluid overload, or pulmonary edema that's not responsive to diuretics, which are medications that increase urine output.
So even with the meds, they're still holding on to fluid.
Exactly.
Wow.
Another key symptom is accelerated hypertension.
Okay.
High blood pressure that's difficult to control, even with medication.
Wow.
And then there's those neurological symptoms,
right,
similar to acute renal failure.
So the uremic encephalopathy and neuropathy.
Exactly. They can lead to a range of debilitating symptoms, including confusion, asterixis, involuntary muscle jerks called myoclonus, wrist or foot drop, and even seizures. And lastly, bleeding problems related to uremia are also a concern in chronic renal failure.
It's a really good reminder of the impact that kidney failure has.
It is.
It's a very complex condition.
It is. It affects every system in the body.
So let's shift gears now and talk about the types of dialysis available.
Okay, yeah.
We know there are two main types, hemodialysis and peritoneal dialysis.
Yeah.
So can you break down the key differences between these two approaches?
Certainly.
Yeah.
So hemodialysis uses an artificial kidney machine to filter the blood outside of the body.
So the blood is actually circulating outside of the body?
Yes, exactly.
Through a machine?
Yeah, so it's drawn from the patient, cleansed using a special filter, and then returned back to the body.
Wow.
Peritoneal dialysis, on the other hand, uses the peritoneum, the lining of the abdominal cavity, as a natural filter.
Oh, so with the peritoneal dialysis, the peritoneum acts as the filter.
Exactly.
Wow, that's amazing how they can use the body like that.
It is. It's pretty amazing how the body can be used that way.
Yeah.
So welcome back, everyone. I hope you're ready for more on dialysis.
Yeah, it's fascinating stuff.
We're going to be taking a closer look at hemodialysis now.
Yeah, I mean, it sounds so delicate, to cleanse the blood effectively, but at the same time not causing any further problems.
Right.
Like what are the key considerations when we're thinking about hemodialysis?
So one of the biggest advantages of hemodialysis is its efficiency. It's incredibly effective at removing waste and restoring that fluid and electrolyte balance. And it can really be a lifesaver in acute situations, but there are definitely some trade-offs.
Such as?
Well, one major challenge is cost. Hemodialysis is expensive, both for the patient and the healthcare system as a whole.
Right.
And it also requires specialized equipment, skilled nurses, and close monitoring throughout the entire procedure.
Yeah, that makes sense. It's not just the technology then. It's the infrastructure and the people to support it.
Exactly. And there are also certain groups of people for whom hemodialysis may not be suitable.
Okay, like who?
So patients with unstable blood pressure. Those with bleeding tendencies, and very young children where accessing the bloodstream is more challenging.
Right. So you're touching on a very important point there. Access to the bloodstream.
Yes.
Given that the blood needs to be drawn out, then returned.
Right.
That access is critical.
It is. So there are two main types of vascular access used for hemodialysis. Temporary and permanent. Temporary access usually involves a catheter placed into a large vein. Typically in the neck, groin, or chest. And this provides immediate access, but it's only temporary until a more permanent solution is established.
So it's like a stopgap measure.
Exactly.
So what about the permanent access then? What are the options there?
So for permanent access, we want to create a sturdy and reliable connection between an artery and a vein, typically done in the arm either through an arteriovenous fistula or a graft.
I've heard the term fistula before. Can you explain how those are created?
So in a fistula, a surgeon directly connects an artery to a vein, usually in the forearm, and over time, that increased blood flow through this connection causes the vein to grow larger and stronger.
So it creates this reinforced pathway.
Exactly.
And why is that considered the best option?
So fistulas have a lower risk of infection and clotting compared to other methods. They're also very durable and can last for many years, which reduces the need for repeated procedures.
That makes sense. So what about the grafts? When are those used?
Grafts are used when a patient's veins aren't suitable for creating a fistula. So they involve connecting an artery and a vein using a synthetic tube, usually made of a biocompatible material. And while they provide a functional access point, they do have a higher risk of complications compared to fistulas.
So whenever possible, go with the fistula.
Yes.
All right, so let's talk about the machine itself now. The heart of hemodialysis, it sounds very complex.
It is a pretty intricate piece of equipment. There are several components working together to ensure safe and effective blood filtration. And it all starts with the dialysate circuit.
Okay.
Which prepares and delivers the specialized solution that helps cleanse the blood.
It's not just filtering out the bad stuff, though.
Whoa, you're right.
You have to maintain that balance of electrolytes and fluids in the blood as well.
Right. So the composition of the dialysate is carefully tailored to match the body's normal electrolyte levels.
Right.
So this solution flows through the dialyzer, the filter, while the patient's blood flows through a separate compartment.
So they don't mix?
They don't mix, no.
Okay.
They're separated by a semi-permeable membrane, which allows those waste products and excess fluids to pass from the blood into the dialysate.
Right, okay.
While keeping the essential blood components in.
That makes sense.
Yeah.
So what are some of the key features, then, of the dialysate circuit?
Okay, so the dialysate circuit includes an anticoagulation site.
Right.
Where heparin, a blood thinner, is added to the blood to prevent clotting as it circulates through the machine.
That's critical. You don't want clots forming inside the system.
And then there's the blood pump, which carefully controls the blood flow rate through the circuit.
Okay.
So it draws blood from the patient's access point, pumps it through the dialyzer, and then returns the clean blood back to the body.
Okay. And are there any sort of safety features?
Yes, absolutely.
Okay.
So after the dialyzer, the blood passes through a bubble, foam trap.
Right.
And this removes any air bubbles or foam from the blood before it goes back to the patient.
Because air bubbles in the bloodstream would be very dangerous.
Incredibly dangerous. They can be fatal.
Yeah.
So this is non-negotiable, this safety feature.
Right, right.
And then there's an additional bubble detector as a final check before the cleansed blood goes back.
So it's really a multi-layered system.
It is.
Designed with safety in mind.
Yes. It has to be.
Wow.
These are life-saving treatments.
Right.
And every detail matters.
Yeah, that makes sense.
It's also worth noting that there are specialized dialyzers and tubing designed specifically for pediatric patients.
Okay.
These smaller components accommodate their lower blood volume and delicate vascular systems.
That makes sense.
Yeah.
So you mentioned that the composition of the dialysate solution is carefully controlled.
Yeah.
So can you elaborate on that? Like what exactly goes into this solution?
So the dialysate solution is a carefully formulated mix of electrolytes.
Okay.
Sodium, potassium, calcium, magnesium, and chloride.
So it's more than just a simple salt solution.
Yeah. Oh, much more. The concentrations of these electrolytes are very carefully adjusted to match the body's normal levels as closely as possible.
To prevent imbalances.
Exactly. Okay, so what else is in the mix?
So the dialysate also contains a buffer, usually bicarbonate, and this buffer helps to regulate the body's acid-base balance, preventing the blood from becoming too acidic.
Okay.
And finally, glucose is often added to the dialysate to help with fluid removal.
I've heard of glucose being used in IV fluids as well.
Right.
What's its role here?
So the glucose in the dialysate creates something called an osmotic gradient, which basically means that the solution draws excess water from the blood through a process called osmosis.
Okay.
And by adjusting the glucose concentration, we can fine-tune how much fluid is removed.
It's amazing how they've replicated the kidney's natural system.
I know. It really is a marvel of modern medicine.
Yeah.
But it's important to remember that, like any medical procedure...
Hemodialysis comes with its own set of risks and potential complications.
Okay, that's a good point. Let's shift gears and talk about those potential risks then.
Okay.
What are some of the things that can go wrong with hemodialysis?
So some of the most common risks include hypotension or low blood pressure, which can happen during or after dialysis, often due to that rapid removal of fluids.
So you're watching the blood pressure very carefully.
Yes, very carefully.
Right.
It can cause dizziness, lightheadedness, even fainting.
And are there any other short-term side effects?
Muscle cramps are quite common.
Okay.
Thought to be caused by those changes in electrolyte levels.
Right.
Itching is another frequent complaint.
Okay, and what about longer-term risks?
So over time, patients on hemodialysis often develop anemia, which is a low red blood cell count.
And why is that?
Well, it's partly due to the loss of blood during dialysis.
Okay.
And the fact that the kidneys, when they're failing, aren't producing enough erythropoietin.
Erythropoietin.
Yeah, it's a hormone that stimulates red blood cell production.
Okay.
So when the kidneys aren't functioning properly, red blood cell production takes a hit.
So anemia management is a big part of their care?
It is. And then there's the risk of bone disease.
Okay.
So when the kidneys fail,
Right.
They can't regulate calcium and phosphorus levels as effectively, leading to bone problems.
So we're monitoring bone health as well?
Absolutely. And we can't forget about those ongoing challenges of managing hypertension and fluid overload.
Right.
If fluid removal isn't adequate, or if patients don't adhere to their fluid restrictions between treatments, these problems can persist and cause real damage.
So patient education is very important.
Absolutely. Education and compliance with their treatment plan.
Okay. Anything else?
So there's also the risk of pericarditis, the inflammation around the heart, as well as hyperkalemia, high potassium level.
Which occurs if they're not careful with their diet.
Exactly, if those dietary restrictions aren't followed carefully.
So it's a multi-pronged approach.
It is. It really is.
To managing these patients, are there any other long-term risks?
Yes, there are a few more.
Okay.
There's always the risk of complications related to the access site.
Right.
Like infections, clotting.
Okay.
Or even aneurysms, which are bulges in the blood vessels.
Okay. And what about amyloidosis?
Yeah.
I've heard that can be a problem.
It is a concern. Amyloidosis is a condition where abnormal proteins build up in the organs and tissues. And this can lead to a range of problems.
Right, depending on which organ.
Exactly, depending on which organs are affected.
And sadly, I understand that depression is very common.
It is.
In these patients.
It is. The burden of that treatment regimen, the impact on their lives, and just the constant awareness of their condition can really take a toll.
Right, so the physical and emotional challenges are all intertwined.
Absolutely, absolutely. And then on top of these general risks, there are also specific complications that can happen during the hemodialysis procedure itself.
Okay, so what are some of the things that can go wrong during the treatment?
So we already talked about hypotension, which can develop quickly, requires prompt intervention.
Okay.
Muscle cramps, another issue, can cause significant discomfort.
Okay.
Nausea and vomiting can occur.
Right.
Some patients experience chest pain or back pain.
What about fever and chills?
Fever and chills could indicate an infection.
Right.
Either at the access site or a more generalized infection.
Okay.
And these need to be investigated and treated immediately.
Of course.
Then there's something called disequilibrium syndrome.
Disequilibrium syndrome?
Yes.
What's that?
So it's a neurological condition that can occur when there are rapid changes in blood chemistry during dialysis.
Okay.
So it usually presents with headache, nausea, vomiting, confusion, and in severe cases, seizures.
So what are we watching for there?
So the symptoms usually develop quickly, so it's essential to recognize them early on.
Right. Okay.
Dialyzer reactions are another potential problem.
Dialyzer reactions.
Yes.
What are those?
So these are allergic-like reactions to the material of the dialyzer membrane.
Okay.
And they can range from mild skin rashes to severe life-threatening anaphylaxis.
Okay, so what are some of the warning signs there?
So they may experience itching, hives, shortness of breath, and a sudden drop in blood pressure.
And if that happens?
The dialysis treatment needs to be stopped immediately.
Okay, wow, so a lot can go wrong.
There is, yes.
Yeah.
So arrhythmias, which are irregular heartbeats, can also occur.
Right.
And these can be triggered by electrolyte imbalances or sudden shifts in blood volume.
Okay.
And cardiac tamponade, it's rare.
Yeah.
But it is a possibility, especially in those who already have pericarditis. So you want to look for chest pain, shortness of breath, a rapid heartbeat, and a drop in blood pressure.
Wow. It sounds like a lot can happen.
It's a true medical emergency, cardiac tamponade.
Wow.
Intracranial bleeding, bleeding in the brain, can occur in patients with underlying bleeding disorders.
Okay.
Or uncontrolled hypertension.
Okay.
Seizures are also a possibility, usually related to those electrolyte imbalances or disequilibrium syndrome.
Okay.
And then hemolysis.
Hemolysis.
Yes.
What's that?
So that's the destruction of red blood cells.
Okay.
It can happen if the dialysate solution isn't prepared properly.
Right.
Or if there's a malfunction with the dialysis machine.
So a lot of risks.
Yeah.
With the procedure and the equipment itself.
Yeah, there definitely are risks.
Wow.
And vigilance is key, but it's important to remember that for many people with kidney failure, this is a life-saving treatment.
Right.
The benefits often outweigh the risks.
So you mentioned that certain complications are more common with that temporary vascular access, the catheters.
Yeah, so with catheters, there's a higher risk of catheter lumen thrombosis.
Okay.
Which is a blood clot forming inside the catheter.
Okay.
And it can block blood flow and require additional procedures to clear.
So the catheter itself can become a problem?
It can, unfortunately, yes.
Okay.
Infections are also more common with catheters. And because catheters are often placed in those large veins in the neck or chest, there are risks associated with the insertion procedure itself.
Like what?
So pneumothorax, a collapsed lung.
Okay.
Hemothorax, blood in the chest cavity can occur. Air embolism is another concern.
Air embolism?
Yeah, that's when an air bubble enters the bloodstream.
Oh, wow.
And it can block blood flow to vital organs.
Okay.
And can be fatal.
So avoiding catheters whenever possible is best?
In general, yes.
Okay.
Fistulas and grafts are usually the preferred options.
So before we move on to peritoneal dialysis,
okay,
let's talk about the medications that are commonly used for hemodialysis patients.
Okay.
What are some of the key medications there?
So one class of medications you'll see frequently is oral calcium phosphate binders.
What do those do?
They help lower those high phosphate levels that we see in kidney failure.
Okay.
Because high phosphate can lead to a range of issues, particularly bone problems.
So how do they work?
They bind to phosphate in the gut, preventing it from being absorbed into the bloodstream, keeping those levels in check.
And when are they usually taken?
They're usually taken with meals.
Okay.
That's when phosphate absorption from food is the highest.
Right. So timing is important.
Yes, timing is important.
Okay. What about erythropoietin?
EPO, yes.
EPO.
Essential for managing anemia.
Okay.
In dialysis patients, it stimulates the production of red blood cells.
Okay.
And since failing kidneys can't produce enough EPO on their own, we give it as an injection during or at the end of dialysis treatments.
And the dosage is adjusted for each patient?
Absolutely. It's based on their hematocrit.
Okay.
Which is the percentage of red blood cells in their blood.
Okay.
So we want to get that to a healthy range.
What about iron?
Iron, yes.
Because iron's important for red blood cell production as well.
You're right. Iron supplements are often given along with EPO to help the body produce red blood cells more effectively.
Okay.
And these can be given orally or intravenously.
Okay, so we've got the phosphate binders, EPO, iron. What about blood pressure medications?
So antihypertensive medications are crucial for managing blood pressure in hemodialysis patients.
Okay.
Because the kidneys play a key role in regulating blood pressure.
Right.
And when they're failing, blood pressure often becomes elevated.
Okay.
So controlling blood pressure is a major part of their care.
It seems like medication management is pretty complex.
Yes, it's very complex.
In these patients.
But crucial.
Yeah, very important.
Yeah, and one more medication I want to mention is sodium heparin.
Heparin's a blood thinner, right?
It is.
Why is it used in hemodialysis?
So heparin is given to prevent blood clots from forming in the dialysis circuit.
Okay.
The tubing and dialyzer that the blood flows through during treatment.
So it keeps the blood flowing.
Exactly. It's typically administered directly into the dialysis circuit by the dialysis nurse during the treatment.
Okay, so we've covered the key points of hemodialysis.
Yes.
It's incredible technology, but it's not without its risks.
It's not, no.
And challenges.
For sure.
So let's switch gears now and talk about peritoneal dialysis.
Okay.
Can you remind us how that one works?
Certainly. So with peritoneal dialysis, we use the peritoneum, the lining of the abdominal cavity, as a natural filter.
Right.
So a sterile solution called dialysate is introduced into the abdomen through a surgically implanted catheter.
So the peritoneum's taking on the role of the artificial membrane in hemodialysis.
Exactly, exactly. So the dialysate is allowed to dwell in the abdominal cavity for a few hours, allowing waste products and excess fluid to move from the blood across the peritoneal membrane into the dialysate.
Right.
This is called an exchange.
Okay.
And then the dialysate, now containing those waste products, is drained out.
It sounds like a gentler, more continuous form of dialysis.
Yeah, and because of that, it can be a better option for people who can't tolerate those rapid fluid and electrolyte shifts that can occur with hemodialysis.
Okay.
So it's often a good choice for children,
the
elderly, and those with certain heart conditions.
And I understand it can be done at home.
Yes. One of the major advantages is that patients can do their exchanges at home.
Right.
On their own schedule.
Wow.
Giving them a lot more flexibility and independence.
That must be a huge relief to a lot of people.
It is. It is. So who are the ideal candidates?
Yeah.
So patients with acute kidney injury, And severe or persistent hyperkalemia, that's a potassium level above 7 milliQL.
Okay.
They're often good candidates for peritoneal dialysis.
Okay.
It's very effective at removing excess potassium and stabilizing the patient's condition.
So in those cases, it's life-saving.
It can be other cases where it's preferred.
Okay.
People with significant fluid overload, like pulmonary edema or severe hypertension.
So it's tailored to their specific needs.
Exactly. Uremic encephalopathy, which is a brain disorder caused by the buildup of waste products in the blood.
Right. So how does the peritoneal dialysis help with that?
So by removing those toxins from the bloodstream, it can improve mental status and neurological function.
Wow. Okay. Anything else?
Severe metabolic acidosis, which is a serious imbalance in the body's acid-base levels.
Right.
So the dialysate solution in peritoneal dialysis contains a buffer that helps neutralize excess acid in the blood.
So restoring that balance.
Exactly. And lastly, peritoneal dialysis can be used to correct electrolyte imbalances. Like hyponatremia and hypernatremia, which are low and high sodium levels.
Okay, so very versatile.
It is. It's versatile. It can be adapted to address a range of situations.
So let's talk about the peritoneal dialysis catheter insertion. It's a surgical procedure, but generally safe.
It is, yes.
So can you walk us through what's involved there?
So the catheter itself is a soft, flexible tube with several components. So you've got the embedding tool, which helps to secure the catheter under the skin. And the metal Faller trocar, which is used to create a small tunnel through the abdominal wall.
Right, so that the catheter can pass through.
Exactly, to pass through. Then you've got the titanium connector, which links the catheter to the extension tubing used for filling and draining the dialysate. The implantation stylet, which is a stiff wire, helps guide the catheter into the correct position during placement.
So lots of specialized components.
Yeah, a lot of components. What about the materials used during the procedure itself? So you'll have the standard sterile surgical set. Surgical blade for making a small incision. Normal saline to keep the area clean. Sutures to close the incision. And antiseptic solutions to prevent infection.
So, specialized equipment and standard surgical supplies.
Right. And once everything's prepared, the procedure itself is fairly straightforward. The area is numbed with a local anesthetic. A small incision is made, and the trocar is used to create that tunnel through the abdominal wall. Catheters inserted through this tunnel, advanced into the peritoneal cavity, and then the trocar is removed.
So not a highly invasive procedure.
No, generally well tolerated.
So the catheter's in place. Now let's talk about the dialysate solution itself. What exactly goes into that fluid?
So the composition of the dialysate is carefully controlled. To ensure it promotes the movement of waste products and fluids from the bloodstream into that peritoneal cavity. It contains electrolytes like sodium, calcium, magnesium, and chloride.
So more than just plain water?
Yes, much more. The concentrations of these electrolytes are carefully balanced to match the body's needs.
To prevent those imbalances?
Exactly.
What else is in there?
There's also a buffer, either lactate or bicarbonate, to maintain the right pH of the solution. Prevent it from becoming too acidic.
And what about glucose?
Glucose. Glucose is added to the dialysate to create that osmotic gradient, which draws excess fluid from the bloodstream into the peritoneal cavity, where it can be drained out. The amount of glucose can be adjusted to control how much fluid is removed during each exchange.
So it's a fine-tuning mechanism.
Precisely. And we also carefully control the pH and osmolality, the concentration of particles in the solution to ensure it's compatible with the body.
It sounds like a very precise formula.
It is, and there's one more component I want to mention. GDPs.
GDPs?
Yes.
What are those?
So GDPs are degradation products of glucose. They're formed when glucose breaks down over time. High levels of GDPs in the dialysate can actually be harmful, potentially damaging the peritoneal membrane, causing inflammation.
So fresh dialysate, important.
Very important. So let's move on to the actual procedure of peritoneal dialysis. Once that catheter's in, patients are taught how to perform exchanges themselves.
Okay, so can you walk us through that?
Sure. So the first step is gathering all the supplies. Yeah. So fresh bag of dialysate solution, connecting tubing, and a drainage bag.
Right.
Then the patient washes their hands, cleans the area around the catheter with an antiseptic solution to prevent infection.
So cleanliness is crucial.
Absolutely. Next, the dialysate bag is hung on an IV pole. And the connecting tubing is attached to the catheter. So the dialysate solution then flows into the peritoneal cavity.
Okay, and how much fluid is used?
The amount varies depending on the patient's size and their prescription. So once the fluid is in, then comes the dwell time.
Dwell time.
Yeah. Okay. So the dialysate stays in the peritoneal cavity for a certain amount of time, usually several hours, allowing waste products and excess fluids to move from the blood into that dialysate.
And then after that, the dialysate is drained out.
Right.
So the dialysate is drained out after that dwell time.
Yes, exactly. The drainage bag is connected to the catheter. Gravity does the rest. This whole process from filling to draining is called an exchange. Typically repeated several times a day.
So once the patient gets the hang of it, it's fairly straightforward.
It is.
Okay.
And the beauty of it is that it can be done at home.
Right, on the patient's own schedule.
Exactly.
That's fantastic.
Much greater sense of control over their lives.
Now, you mentioned that peritoneal dialysis has, some advantages over hemodialysis.
For sure.
Can you recap those for us?
Yeah, so one of the biggest ones is it's painless.
Right.
No needles.
That's a big one for people.
Huge, yeah.
What else?
So it's a home-based therapy.
Right.
Offers greater flexibility and convenience.
Right.
It's a gentler treatment.
Okay.
Works more like the natural kidney.
Okay.
And doesn't put as much strain on the cardiovascular system.
So less disruptive to the body overall.
Exactly.
But as with any procedure, peritoneal dialysis has its risks and complications as well.
It does.
So what are some of the things we need to be aware of?
So fluid overload is one.
Okay, what are some signs of that?
So keep an eye out for high blood pressure.
Right.
Swelling in the legs and feet. Any signs of fluid in the lungs, like shortness of breath.
Okay.
Crackles that can be heard with a stethoscope.
So fluid overload can be very serious.
It can be. If left unchecked, it can lead to heart problems, breathing difficulties.
Wow.
We also need to be aware of the risk of fluid underload.
Okay.
Where the body's losing too much fluid.
And what are some signs of that?
So look for low blood pressure.
Right. Opposite.
Rapid heartbeat, muscle cramps, particularly in the legs.
Okay.
And then there's peritonitis.
Peritonitis, what's that?
So that's an infection of the peritoneum.
Got
It's
it.
serious complication, requires prompt treatment.
So what are the signs of peritonitis?
So abdominal pain, especially during the exchange, is a red flag. You might also see nausea, vomiting, cloudy outflow fluid.
Cloudy fluid, what does that mean?
So if the dialysate
Okay.
that's drained from the abdomen looks cloudy or discolored,
Okay.
that could be a sign of infection.
Okay.
And patients with peritonitis will often have the usual signs of infection, like fever, chills, fatigue.
So we're watching for local and systemic signs.
Exactly. Early detection and treatment are key.
Okay, so we talked about peritonitis, but what are some of the other possible complications with peritoneal dialysis?
So bleeding after catheter insertion can occur.
Okay.
Usually minor, though.
Okay.
Perforation of the gut is a rare
Okay.
but serious complication.
What happens in perforation?
So essentially, it creates a hole in the intestine.
Okay.
This can lead to leakage of intestinal contents into the peritoneal cavity, causing severe infection.
Wow, so what are some other complications that are related to the catheter?
So abdominal pain is a common complaint, often related to the catheter itself or the dialysate solution.
Yeah. Okay.
Leakage around the catheter can happen, increasing the risk of infection.
Right.
Difficult drainage can also occur.
Okay, so the dialysate is not coming out.
Yeah, not flowing out properly.
Oh, okay.
And then there are pulmonary complications.
Pulmonary complications, how can peritoneal dialysis cause lung problems?
So the fluid in the abdomen can put pressure on the diaphragm,
Right.
making it harder to take deep breaths.
So like a mechanical restriction?
Exactly.
Yeah.
And then, of course, we're always watching for those signs of peritonitis, which can develop quickly and become quite serious.
Yeah. Okay, anything else?
Metabolic problems.
Okay.
Like fluctuations in blood sugar.
Right.
Electrolyte imbalances. And then disruptions in the body's acid-base balance can also occur.
It's a lot to keep track of.
There is.
Wow, so you mentioned before that, peritoneal dialysis has its advantages,
Yeah.
but also disadvantages
Right.
compared to hemodialysis.
Right. So one of the main drawbacks is the risk of infection,
Right.
particularly peritonitis.
Okay.
Weight gain can also be an issue.
Okay, and why is that?
Because the dialysate solution contains glucose,
Right.
which can be absorbed into the body.
So diet is very important
Yes, very important.
for these patients.
Dietary modifications, careful monitoring of their calorie intake.
Okay.
Hernias can also occur due to that increased pressure in the abdomen from the dialysate fluid.
Right.
And finally, there is a risk of inadequate dialysis.
Okay, and what causes that?
So that can be caused by a number of things,
Okay.
including problems with the catheter,
Right.
not following the exchange schedule properly,
Mm-hmm.
or changes in the peritoneal membrane that make it less permeable.
So if it's not working effectively, we need to figure out why.
Exactly.
Okay, so we've gone over hemodialysis.
Yes.
We've gone over peritoneal dialysis.
We have.
Can we do like a side-by-side comparison now?
Huh.
Okay, so let's start with effectiveness.
Okay.
Which one is better at removing waste products from the blood?
So hemodialysis, with that high-tech filtration system, is generally considered more efficient
Okay.
at removing waste.
Okay.
However, peritoneal dialysis is still a viable option,
Okay.
especially for those who can't tolerate hemodialysis
Right.
or prefer that flexibility of home-based treatment.
Okay, what about the frequency of treatment?
So hemodialysis usually requires 3 sessions per week,
Okay.
each session lasting several hours.
Okay.
Peritoneal dialysis, on the other hand,
Uh-huh.
typically done daily
Okay.
with multiple exchanges throughout the day or overnight.
So more frequent but shorter sessions
Exactly.
versus,
Yeah.
less frequent but much longer.
Exactly.
Okay. What about, just the scheduling flexibility?
So peritoneal dialysis wins there.
Okay.
Patients can do their exchanges at home
Right.
on their own time.
That's a big one.
Yeah, without having to travel to a center.
Okay. What about in terms of risks and complications?
So hemodialysis carries a higher risk of complications related to the vascular access, like infections,
Right.
blood clots,
Right.
and the rapid fluid and electrolyte shifts during hemodialysis can also be problematic.
And with peritoneal dialysis?
Peritoneal dialysis has that higher risk of peritonitis
Right.
and other infections.
Okay.
Weight gain and hernia formation are also potential concerns.
So it really is, a risk-benefit analysis.
It is. Absolutely. The best choice depends on the individual patient,
Right.
their needs, their health status, their lifestyle.
So what about the need for vascular access?
So hemodialysis requires a dedicated vascular access point, either a fistula, a graft, or a catheter.
Right, to draw and return the blood.
Exactly.
Okay, and peritoneal.
Peritoneal dialysis just requires that peritoneal dialysis catheter,
Right.
surgically implanted in the abdomen.
Okay, what about the level of involvement, I guess, from the healthcare team?
So hemodialysis requires a whole team,
Okay.
including nurses, technicians, nephrologists.
Right.
Treatments are usually done in a dialysis center.
Right.
Peritoneal dialysis can be done at home
Right.
with less direct involvement.
Right. So the patient's taking on a little more responsibility.
Yeah, for sure.
And their caregivers, their family.
Yeah, family members may need to be trained to assist.
Right, depending on the patient.
Exactly.
Okay, and then finally that difference between home-based and center-based.
Right, so peritoneal dialysis at home,
Right.
more independence, more control over that schedule.
Okay.
Hemodialysis, generally done in a dialysis center.
Requires those regular trips.
Exactly.
So, wow. Okay. So choosing between the two is a very, it's an individual decision.
It is.
It's not one size fits all.
Not at all.
Wow. Well, I think we've covered a lot of ground today.
We have.
From the basics of dialysis to, really the intricacies of each type.
We really got into the weeds.
We did. It's fascinating. And I just want to reiterate that dialysis in all its forms is really a remarkable treatment.
It's life-saving.
It is.
For people with kidney failure.
So before we wrap up, I want to go back to something you said earlier.
Yes.
About the future of dialysis.
Okay.
How do you think advancements in technology are going to change the landscape of treatment moving forward?
Ooh, that's a great question.
It's a big one.
It is, imagine a future where artificial kidneys are fully implantable.
Wow.
Perhaps we'll see bioengineered kidneys.
Wow.
Grown from the patient's own cells, becoming a reality.
Those are exciting possibilities.
They are very exciting.
It gives a lot of hope
It does,
to these patients.
Yeah.
So much potential for the future.
So much potential.
Yeah. And on that note of optimism, I think we're going to wrap up this deep dive.
Okay.
Thank you so much to the London HeartbeatsZ Academy for providing this amazing material.
Yes, thank you.
Really appreciate it.
Their resources are incredible.
And to our listeners, thank you for joining us.
Thank you, everyone.
Be sure to subscribe to The Deep Dive so you don't miss any future episodes. We're constantly exploring new topics.
Always something new.
We'd love for you to join us on these deep dives.
Yes, join us.
Until next time.